there. Good.
Yeah.
It's good to see you, Daniel.
Thank you. It's good to see you.
I must say, Daniel has this habit of his of when there's a pandemic going through East Africa, he tends to participate existentially, not just intellectually. And so I think it's no surprise to you that Daniel has HIV and was, in fact, the first person probably treated in the country in the public hospital for HIV. And is in many ways, a lot of people have been called the father of AMPATH. I'm not sure without the encounter with Daniel we would be having the session we're having even today. But Daniel not only was one of the first to really present and get treated for HIV, he went ahead, just to keep the record straight, he went and got COVID as well this year. And so as we talk about the impact of HIV and COVID and together, I think we're fortunate to have Daniel talking to us, since he seemed, Daniel, I'm only hoping we don't have a third pandemic, because I don't think you really need any further demonstration of your willingness to get involved. We're going to come to your feelings about.
Yeah, I did. That's enough.
Yeah, that's enough, Daniel. But for some people, they don't know what the situation was at MTRH in the year 2000 when you and I became acquainted on the wards, or 2001. Could you describe a little bit about what you were seeing at that time, at the very beginning, around the year 2000, when you knew you were infected and you were going to end up in the hospital on my ward? Just why don't you describe a little bit of what the world was like then? We understand what it looks like now, and even a lot about what's happening with COVID, but perhaps it'd be well to step back in time and get your perspective of what it looked like from a HIV patient perspective in the year 2000.
Thank you, Joe. Yes, okay, so back in 2000, with HIV, it was basically almost a death sentence in Kenya, unless somebody was very rich and they could be able to afford treatment in private facilities, which was very expensive. I don't think many Kenyans were able to raise that amount of money. So there were a lot of deaths due to HIV at that time. I remember particularly the ward where I was, the cubicle in which I was placed. Every day I would wake up and one or two people had passed on, and most of it was due to HIV. So it was really frightening in the wards, because you'd wake up and your neighbor is being wheeled to the mortuary the next day, so it was terrible. A lot of people were dying, and because there was no treatment, there was also very little testing that was going on. The only testing that was going on was through VCT, which was voluntary counseling and testing. So very few people were being tested. And part of the reason I probably think was because people felt, well, if I have it, I'll just wait until I get sick and die, because even if I go and get tested, there would be no intervention at that time. Yes.
Well, I remember you very well in the hospital at that time, Daniel, and I must say, when we did finally, thanks to Joe Wheat at Indiana, we were able to get the funds to treat you. Just to remind people, it was $1,000 a month for the medicine at that time. I think those same drugs are around $6 or $7 now, but this is, as Daniel said, it was almost untreatable in those days. But as you began to improve and we got ready to discharge you, do you remember anything about how you felt leaving the hospital, or what you what your hopes or feelings were as you were leaving the hospital as the first patient on drugs leaving the hospital.
So basically, I had two hopes and aspirations at that time. One of them was, of course, to get my strength back and go back to School of Medicine. But the other aspiration was to really join the fight against HIV and, like really help us to prevent as many infections as possible, and also to help many people who had been diagnosed to be able to live. So I had hopes that probably one day there would be treatment for other people and not just me, because I was feeling like, okay, I'm going to be well, most likely, but I'm going to be alone. Many people are dying and there's no help for them. And those who can get the treatment are probably unreachable to me because they are in private facilities and I don't know them. So my hope was that there would be treatment for many more Kenyans, that I would be able to get back to medical school and finish my studies, and that I would be able to actively participate in the fight against HIV and defeat the pandemic.
As I recall, Daniel, you were a fifth-year medical student when I first met you on the wards. And I don't believe I'd ever met you personally, except when I met you as my patient.
Yes, we had
not. You say you were a fifth-year med student, almost a year away from graduation. What were some of the things you ran into when you got discharged, and things that led to your not being able to continue in medical school?
So, okay, after I got discharged, of course, the first thing that I ran into was stigma in a private hostel where I went to stay with my mom, and the students who were there were not willing to have me in there. They almost felt like I was going to die any minute, and so I think they were afraid. And so that was my first encounter with stigma in the outside world. And then, of course, I tried to get back to the School of Medicine, and I had a visual problem. I had lost vision on one eye due to CMV, and then the other eye started deteriorating, and I had to go to Indiana, thanks to Joe and who helped me to get that, and I got my surgery in Indiana. And I was hoping to get back and continue with my studies, but when I got back, I ran into a block by the School of Medicine. They were not going to allow me back into the school. I remember we had a committee set up to review my case. I was invited to that committee. I explained to them that I was not expecting to be a surgeon, but I wanted to get a chance to finish my studies and at least work as an internist in the HIV clinics. But I think they just were not comfortable with me continuing with my studies. I never, of course, got any communication, which usually happens in any university. Like, you get an official communication explaining reasons as to why your studies have been terminated. But in this case, none of that happened. So I also viewed that to be partly
Daniel, are you still speaking? I'm not hearing.
Due to the stigma arising. I think I'm comfortable to have a colleague who was HIV positive and was willing to go public. And I think that probably contributed a lot to them not allowing me back to go to school.
All right. Daniel, I remember very well as we got started and to try to treat a few patients, you immediately stepped forward before anyone else, determined to say out loud, I have HIV, and to be very, when no one would say such a sentence, you just were willing to speak out and take on stigma straight out. What were some of the things going through your mind as you found the courage to do that in those early days?
Well, I think what really was motivating me was the urge to save more people, because what was going through my mind was many people could not. Many people thought that if you had HIV, you were alone, and maybe the person next to you didn't have it, or nobody else in the streets had it. So the idea in my mind was that if we had more people coming out to say that they were HIV positive, especially in this region, then we would encourage people to, get the courage to go and get tested and to get onto treatment. And the other thing that was going through my mind was that I needed to make people believe that HIV treatment works, and that even if you get diagnosed but you can access it, then you will be able to live for long. And I remember when we were launching the first support group at the School of Medicine boardroom, there are so many people who just came in because we had publicized it and said that we will have people living with HIV coming together to talk and share ideas. And many people just came to see who are these people that are so brave to say that they'll be meeting in a room, they have HIV, and they are inviting the public to attend. People were standing by the door side, just listening, and the room was full. I think, Joe, you attended that launch briefly, because you also had to be in the wards and in the clinic.
Daniel, I know that from that moment on, you've been an integral part of the growth of the AMPATH story that Professor Kamayo described. Can you just briefly summarize kind of your own professional career within AMPATH up to this time? And then I want to turn our attention to COVID.
So after that, I started by running the psychosocial support services. And on top of that, we layered on the outreach services, which was mainly focused on patient retention. And later on, it evolved to be AMPATH retention department. So I've been managing psychosocial support and retention for most of that time. And then I then later on started the client satisfaction department, which is a totally new department. I think my experience with retention was I've really grown a lot. I've really developed in that. And I remember even currently, as we use POC in AMPATH, what people don't know is that the department that initiated the use of POC was actually in retention. We were using mobile phones with the JJ, and we trained the workers, and they were able to key in data live as they called patients or as they did follow-ups. And so I'm glad that my experience has actually led to the development of a new way of doing things within AMPATH.
Oh, that's wonderful. Daniel, as Adrian mentioned when he introduced you, denied to get your doctorate degree in medicine, but that hasn't stopped you. And we know that you are now actively enrolled in the doctoral program in public health leadership at the Fairbanks School of Public Health here at IUPUI. And you're in your second year of that course. Can you, how has COVID and affected that educational journey for you so far?
I think, okay, the main challenge that has come up was the fact that we cannot have on-campus meetings as we used to have before for introduction of courses. So all our classes and even course introduction is being done via Zoom. But in terms of the classwork, when I was diagnosed with COVID, I was feeling not so well for almost 2 weeks, and that made me lag a little bit behind. But I would say so far I'm coping well. I've been able to attend most of the classes. Of course, with the challenges of COVID, it's not easy for us, because it's not business as usual. Like we can't interact as a class as much as we used to interact before.
Well, Daniel, you experienced both HIV and COVID. How most of us would like to throw the year 2020 into the trash. How are you feeling about the year 2020 as you look at it, particularly looking back to the year 2000? Does 2020 stack up as being just about as lousy as 2000, or what are you seeing these days?
Well, I can say 2020 almost compares to 2000 because a lot of deaths in 2000. There were a lot of deaths in Kenya due to HIV. 2020 people are dying. We are having a lot of deaths due to COVID. But as a person, I have a better feeling of the future in 2020 than I had in 2000. In 2000, that before we met and I started treatment, I was almost, things were so grim for me. I was like probably thinking of my last wish before dying. In 2020, even when I got diagnosed with COVID, I somehow felt that I would manage through it without fear. I didn't panic. I didn't, it was like just, being diagnosed with malaria to me. So I'm kind of, 2020 looks, even despite the challenges that COVID has brought, 2020 still looks to be more brighter to me than 2000 was.
Well, Daniel, how do you think COVID, as you're so involved in patient retention and so many issues around HIV care, how do you feel COVID has begun to impact or is affecting HIV care in Kenya right now?
I think specifically it is affecting patient retention and adherence to medications because many patients are beginning to fear that the hospitals are hotspots for COVID, that if they go to the facility, they can easily contract COVID. So many of them are keeping away. We saw a sudden increase in new cases of loss to follow-up. And when we try to contact them, people say we are afraid to come. And so we have to convince them that they should come. And of course, if somebody fails to come to the clinic, it means they are most likely going to also miss their medication. The other thing is that there's been a lot of shift of attention to COVID, and HIV has sort of been not given so much attention in terms of even finding new cases and also continuity of care for those who are already on treatment. So we are seeing a situation where two pandemics are competing for limited resources, and I think that has affected HIV care greatly.
Well, Daniel, I don't know if you want to leave that as your final word as you look for your plans or hopes for the future, but from where we sit right now, I share a lot of your concerns that the donor community has gone basically more in debt. Each country is struggling. It's got to have an impact on the donor community and the support the HIV program needs. And as you indicate, it's had begun to have an impact on behaviors of people with HIV. The very things that have kept them under control is in jeopardy. And how do you see the future? What are your hopes and thoughts about the future coming up?
I'm very hopeful about the future. I think that we'll be able to overcome COVID, and we'll be able to again refocus on HIV as something that is really a major pandemic. I also, in the future, I also hope to be able to be engaged more in health policy and making, and also health systems management, because that is a key area of interest to me. I really feel that most of the problems, like if you look at the health problems that we are facing, the professional capacity is there, the treatment are there, but the problem is how do we get the treatment to the people who need it when they need it? And that's where health systems and health policy issues come in. So if we can embrace more the role of health policy and health management more in patient care, especially when dealing with pandemics, then I think we are likely to have better outcomes in handling pandemics.
Well, Adrian, we'll finish up here. I do think that as Daniel's optimism about the ability to handle both the HIV pandemic and now the COVID pandemic. I'm heartened by your optimism, Daniel. I just encourage you, whatever comes along next time, you don't need to feel any obligation to get the disease. You can provide some management from a distance, it'll be okay. Let me turn it back to Deb and Adrian right now. Okay.
Thanks, Joe, and thank you, Daniel.
Thank you.
I also remember the days of 2001, Daniel, your bravery and trip to Nakuru, where you we went down to the children's home there, and you stood and talked to everyone about HIV. So we are so grateful to have you still as part of our effort and our program. And thanks again for being here today. So.